I was really surprised after I had a CT scan to find out that it could possibly be cancer.
Well, for Ms. Thomason, she's a prime example of how lung cancer screening can make a difference. And so she had a very astute primary care physician, Dr. Umana, who saw her smoking history, got a low-dose CT scan looking for lung nodules, identified a nodule on her CT scan, and then referred her to pulmonology, and that's where she and I met. Thereafter, because of Ms. Thomason's nodule being small and we weren't certain because it just showed up on that imaging, we decided to follow it for a while. When we saw that it started changing, that's when we started to pursue the thought of biopsying.
So I went to Dr. April McDonald. She was my pulmonologist, and she took it to her tumor board, who included Karen Gersh, the surgeon, and they thought that it was probably going to be adenocarcinoma, which is a cancer cell. But they weren't 100%, so they were thinking about doing a biopsy. But because I had some emphysema in my left lung, in the upper lobe, it would have been really risky to do the standard biopsy where they go in from the side and do a biopsy. They were afraid my lung would collapse. So Dr. McDonald wanted to do the robotic biopsy and leave a marker, some type of a marker where she did the biopsy. So in case it came to a lung resection, which is they just take out a part, they would know where to go. So on Monday, I think it was September 11th, we went in and she did the biopsy, and she had to go down through my airways to get to it. And it was risky. She said that my lung may collapse, but it was great. Everything was good there. She did the biopsy. I woke up fine. I was good. I went home, no problem. And then, of course, I get on my chart and see that it part of the biopsy did come back as adenocarcinoma.
Ms. Thomason was a lady who had been a smoker for many years, and we've learned that there are criteria which many people can fall into. If you've been a long-time smoker, you qualify for a low-dose lung CT, almost like a mammogram for women of certain ages. So she underwent a low-dose lung CT and was found to have an abnormality in her left upper portion of her lung, the left upper lobe. She subsequently was sent to an oncologist, and the oncologist astutely understood that this is something that needs to be evaluated by a thoracic surgeon. She was sent to me. I evaluated her and identified that this area of concern was not a solid mass, but something that was evolving into a mass. And these areas of ground glass opacity are not quite mass-like areas, are very difficult for me to identify in the operating room, to biopsy to confirm that it's a cancer, and also very difficult for percutaneous biopsy, where a radiologist uses a CAT scan table to try to localize this area. So I sent her to my colleague, my interventional pulmonology colleague, Dr. McDonald, to use a really sophisticated robot bronchoscope to look down her airway, navigate out through the airways to this area of concern, so that Dr. McDonald could perform multiple biopsies to confirm that it's a cancer or not, and place a little marker, a little metal marker into the lung tissue, so that on the off chance that Dr. McDonald was unable to confirm cancer at the time of the bronchoscope, I certainly could take her to the operating room a couple of days later, put my robot, my Da Vinci robot scope in between her ribs into her chest, identify that little marker, go down to it, and perform biopsies to confirm a cancer, then proceed with a really sophisticated and a bit more risky lung cancer surgery.
To me, the fact that I was a smoker tells you right there that you're going to have some problems. I mean, I remember years ago when somebody said, it's not a matter of if you're going to get COPD, it's a matter of when. I thank God that I don't have COPD, but I did have emphysema and I did have lung cancer. And I never would have known that until it was too late had I not had the CT scan. So I would recommend everybody who has ever smoked or been around secondhand smoke, or even though you don't have any symptoms, it's worth that money. It's just not a lot of money, but it's worth it. Go get you a baseline CT scan. And hopefully when you get those results, everything's good. But you need to know. Because if, like I said, if you wait till you have symptoms, it's too late, or you're gonna have to have treatments. Because now, my post-op is I have to see an oncologist once a year for a CT scan, just to make sure. But a lot of stories don't turn out as good as mine because they waited too late.